SSRIs, the selective serotonin reuptake inhibitors. As the name suggests, SSRIs inhibit or block SERT, which is a serotonin transporter. The serotonin transporter is responsible for the uptake of serotonin from the synaptic cleft into the presynaptic neuron. By blocking SERT, it prevents the uptake, and therefore there's significant serotonin available in the synaptic cleft to bind to the range of serotonin receptors to create downstream effects, some of which are beneficial, some of which can lead to side effects. The key serotonin receptors that play a role in the mechanism of action of SSRIs are the following. Firstly, we have the 5-HT1A receptor. Now, the 5-HT1A receptor is situated on the presynaptic neuron. Any receptor that's situated on the presynaptic neuron is known as autoreceptor. An autoreceptor acts as a brake on the release of the neurotransmitter. So if I activated the presynaptic autoreceptor, the 5-HT1A receptor, it would stop the release of serotonin into the synaptic cleft. The three other receptors are 5-HT2A, 5-HT2C, and 5-HT3. The 5-HT2A receptor is situated in the limbic system. When this receptor is activated, it can result in feelings of anxiety. The 5-HT2A receptor is also situated in the striatum. When this receptor is activated, it reduces dopamine. The ventral striatal area is responsible for the feeling of reward. It's the nucleus accumbens. So the nucleus accumbens and ventral striatal area, the words are used interchangeably. So when the 5-HT2A receptor is activated on the ventral striatum, there is a reduction of dopamine. And this is what results in the emotional blunting, and in some cases, reduced libido or reduced desire as well, the sexual side effects of SSRIs. The 5-HT2A receptor is also situated in the reticular activating system, which mediates sleep. When that receptor is activated, it can disturb sleep or result in insomnia because it reduces REM sleep. Next, we have the 5-HT2C receptor. The 5-HT2C receptor is situated lower down in the spinal cord, and when this receptor is activated, it can result in sexual dysfunction again. Furthermore, the 5-HT2C receptor also controls appetite. When this receptor is activated, it can have an anorexic effect, reduction of appetite. And finally, we have the 5-HT3 receptor, which is situated in the gut and also in the hypothalamic nausea and vomiting area. If this receptor is activated, it can result in side effects such as diarrhea and can also have side effects such as nausea and vomiting. What happens when an SSRI is first prescribed? The SSRI will block SERT. There will be increased serotonin available in the synaptic cleft. It will go and bind to the 5-HT2A receptor. It can result in anxiety in the first week or so. It can result in emotional blunting, reduced dopamine in the frontal lobe and the ventral striatum, and it can affect sleep. By activating 5-HT2C, it can result in sexual dysfunction and a decrease in appetite. By acting on 5-HT3, it can result in diarrhea or in some cases nausea as well. So what we can see here is in the initial stages of SSRI prescribing, there are a number of side effects that are possible. So we must tell patients to look out for these side effects in the initial phases. Now, whenever a receptor is activated, there is a compensatory downregulation that occurs. So these receptors, the 5-HT2A, 5-HT2C, and 5-HT3, they will downregulate as the serotonin continues to activate these receptors. And it's the downregulation of these receptors that minimizes the side effects over the long term. Now, not all side effects subside completely. In some individuals, side effects such as emotional blunting, sexual dysfunction can persist. But in most cases, if the dose is kept at the minimal effective dose and the receptors sensitized, then side effects can be minimized